Child's Trust Hospital and Research Foundation is providing very good clinical service to children in Chennai and the neighbouring areas. In addition, they provide high quality education because it's one of the very well center which is much in demand for the DNB program in pediatrics and pediatric specialties. Plus, they've also always had a tradition of research, conducting ethical research to meet the needs of the children. This addition of the research laboratory and the advanced facilities for molecular diagnostics will allow them to go even further and be able to start doing research in areas where previously the knowledge is not there. So in my discussions with the doctors and the staff here today, we were talking about the shifting profile of the disease burden in India, particularly in Tamil Nadu, where because of our success in the public health program, in the immunization program, to some extent water and sanitation, we have and a focus on the maternal health and institutional deliveries, we have been able to substantially reduce maternal and child mortality rates, under 5 mortality. But at the same time, as you reduce infectious disease burden, the burden of other diseases, what we call as non-communicable diseases, is increasing. Autoimmune diseases, diseases caused by environmental risk factors, genetic diseases because children are surviving, mental health disorders, new diseases like gaming disorder, addiction to digital tools, addiction to social media, addiction to video games. These are all emerging diseases, and we have to look into the future to see what are going to be the needs 5 years from today and 10 years from today. The needs for infectious disease care will hopefully come down even further. There will be a growing number of children who have chronic disease, who have cancer, who have autoimmune disease, and who have need for rehabilitation services. Because as children survive, there will no doubt be more children surviving with disabilities, congenital blindness, deafness, other kinds of physical and intellectual disabilities. And in order to attain a good quality of life, they are going to need a lot of devices, assistive devices. They are going to need hearing aids, cataract surgery, spectacles, other kinds of motor devices. So rehabilitation is going to be important. And this is what we mean by universal health coverage. WHO defines universal health coverage. It's not only about diagnosis and treatment, but it's also about rehabilitation and palliation for chronic pain. And very importantly, it's also about disease prevention and health promotion. Most of us in the health field, especially doctors, we focus on a patient when they are ill. But why did they become ill? Could we have prevented it? What could be the factors which we need to take into account to reduce the sickness, reduce ill health, increase the wellness? So universal health coverage is about keeping people healthy. It is what SDG 3 goal is. It is well-being and health, not the absence of disease. So I think in India also, right from 1947, after in 46 we had the Board Committee report with a focus on primary health care. The focus was always from the beginning on primary health care. I think we need to go back now to that concept. How do we provide good primary health care? Because any number of big hospitals we build will not be able to take care of the sick if we are not able to prevent and treat diseases in the early stages. For children also, we need to start thinking in this way. What does primary health care for children mean? What does disease, what are the preventable? We know immunizations is one big preventive intervention because you prevent a lot of infections by giving vaccines. So just like that, what are the other things we need to think about that can prevent the onset of other types of diseases? And everything cannot be prevented. So when the disease occurs, then how do we diagnose early and how do we provide optimal care, which includes support services. So that is taking a holistic view of health. And now that this hospital is looking ahead, so what are the new frontiers? What are the areas where research can throw more light? These are probably some of the areas where this could happen in collaboration with other partners, both in the government and in the private sector, and also building up more international collaborations would also really help to bring new ideas and improve the quality of the research.
It's rated the #1 childcare hospital in the state, among the top 3 in the country. It's a not-for-profit hospital, 220-bed hospital. This is one of the hospitals that provides free care to the needy. People who cannot afford good tertiary treatment, they are given free care by this hospital thanks to the beneficence of so many people who donated, not only in terms of equipment but also in terms of childcare. That's something that we want to continue in this hospital, to increase the proportion of children that we treat free of cost. And the additions, like Dr. Soumya talked about, in addition to academics, now the third leg that we are trying to build is research into newer areas, so that we have a good functioning laboratory. As we add more and more researchers, we will have a handle on the new types of paradigms, new types of diseases that are coming up, and we'll be well prepared to serve the community.
Departments are setting up de-addiction centers, particularly for digital addiction, the game addiction or other type of social media addiction. So NIMHANS, I think in Bangalore, was one of the first to set up. After that, many have followed, and possibly that could be also something that Child's Trust considers too. Health literacy is very important. Very often people don't know what are the risk factors for disease, what is good, what is bad. It's all hearsay. I think, correct information to be provided to the public is very important. For example, you can take vaccines. A lot of misinformation campaigns get circulated on WhatsApp and so on. And that really affects the vaccination coverage. And then after so many years now, you have started seeing diphtheria cases, pertussis cases, because parents are not doing vaccine. This is not just an Indian phenomenon, it's a global phenomenon. What is different now is because of social media, these false messages and rumors can spread very fast. So I think it's very important for doctors and others in the medical field and for the government to really give the facts as to why vaccination is the most important. In fact, Bill Gates, he describes this very well. He says adults are caused by vaccines. 50 years ago, half the children who were born would die, either of pneumonia or diarrhea or measles or meningitis. Today, it's less than 1% of children who are dying. Why? Large extent is because of vaccines and because of antibiotics. People should understand. You see, nowadays we don't see polio. We have forgotten what a dreadful disease polio was. We had 300,000 cases in India in the 1980s before we were completely eliminated. Today the world may eradicate polio. Only possible because of the vaccine. So this is part of preventive and community outreach, really giving information. Nutrition is another area. I think there are a lot of misconceptions. People are eating a very poor diet now. That's a major risk factor. Unhealthy diet is a major risk factor today, both for malnutrition and for overnutrition. More and more you see obesity happening, especially in Tamil Nadu. And so, what really is a healthy diet? How many calories should we be eating? How much exercise should we be doing on a daily basis? What are the other practices which are good for maintaining health? That's why I was saying that health is about maintaining a healthy physical as well as mental health, not just about preventing or absence of disease. It's definitely, as far as the WHO norms are concerned, we are falling short of health professionals in our country. What is more important is the imbalance in distribution between northern and southern states and between rural and urban areas. So rural areas there's a shortage of doctors, and more importantly there's a shortage of people like physiotherapists, dentists, rehabilitation experts. See, sometimes we only think about doctors, we don't think about these other needs of the population. So I would say that to provide primary health care, there are many countries in the world which do not have doctors. Primary health care is provided by well-trained nurses. So to have the concept of a community health practitioner who doesn't have to go through a doctor's full training, but who has a basic training in order to provide care for the most common diseases and is able to pick up and refer for the most serious things. So that could be either a nurse with special training, or it could be a person who goes through a training program as a community health practitioner. So to provide good quality medical care, definitely you need doctors. You can't have a system without doctors. But you can make do in many cases with a team that is managed by a nurse practitioner or whatever we like to call that person, provided doctors are available for backup and referral services. So I think that's the way in which probably India is also thinking now of moving, because to provide 1.3 billion people with good quality health services, we're not going to have enough doctors in the coming years to do that. On your first question on the resurgence of diseases like diphtheria and pertussis, it's clearly due to lack of population coverage of vaccines. For many of these infectious diseases, you need a herd immunity. That means you need at least 90% of the children who have got vaccinated. So once you start falling below that, measles is another good example. We had so many outbreaks all over the world. So ensuring 100% vaccination coverage is very important.
Ma'am, but these are good vaccine states which have good vaccination coverage. Kerala, Tamil Nadu, where the vaccination coverage is.
Even states with good vaccination coverage, there are pockets in which there are many reasons for that. It's not only the parents are refusing, there are other reasons also. That needs to be analyzed. The good thing about Tamil Nadu is the excellent health information system that we have. In one case, we're able to recover and investigation is done. So the data and the transparency of the data in Tamil Nadu is to be important. Based on that, action can be taken. Pocket can be identified. In Kerala, it was very clear that it was among the particular people and particular communities so action was taken. So I think looking at the data and doing a micro-level planning is going to be more and more important. The other thing you mentioned about infectious diseases, the big threat we have today is, of course, antimicrobial resistance, drug resistance. So even today, the doctors were discussing, there are many cases even today where no antibiotic is working. And despite all best efforts, the child dies. So we have to be very careful about the use of antibiotics, about protecting the antibiotics we have today, which is called a stewardship, so that we are not in that situation where we were before the discovery of penicillin. There's really nothing we have to do to treat infections. It's not implausible that we could reach that situation if we continue to abuse antibiotics.